Hi, my name's Tara Winkler. I'm the co-founder of CCT. A lot of people ask us how our Village Hive model actually works, so I thought I would just talk you through a quick video that explains how our social workers partner with families to take them from a place of vulnerability to empowerment and self-reliance. So the first step of the process after a family is referred to CCT is that the social workers will conduct a home visit, and on that home visit they'll work with the family to do an assessment of their basic needs, and that assessment looks at everything from education, so are the children enrolled in school, food, do they have enough to eat every day, do they have adequate supervision or do they need before and after school care, do they have the required documentation to allow them to access public services for free, do they have any acute or chronic health concerns, do they have safe and secure housing, and are there any safety concerns that are placing the children at risk. If there are safety concerns, that family will then be referred to a senior social worker who will work with the family and their extended network to create a safety plan with the family using the Signs of Safety framework. Even with these families though that do have child protection concerns, they will still be encouraged to go on this process, because what we often find is that the behaviours that put children at risk and are causing these safety concerns are often caused by the stresses and pressures of poverty. So when the family are able to meet their basic needs and provide for their family, and also when they have a sense of purpose and accomplishment, that a lot of these behaviours that are creating the safety risks resolve naturally. So after the basic needs assessment is done, the next step is to provide a support payment and connect the family to public services. So what this involves is the social worker explaining this journey to the family, and together they agree upon a support payment from CCT that will meet all of their basic needs, but will also be realistic for the family to cover themselves in the future. So the family then will agree to go on the journey with CCT, this empowerment journey, and part of that agreement is ensuring that the family understand that all of the support payments that CCT provide, including any sort of one-off payments to, say, repair a house or whatever, those payments are a gift and not a loan. So the family will never need to pay back any historical or one-off payments that are provided to them from CCT. So at this point, in step number 1, we know that the children are safe and the family have all their basic needs met. The problem is, though, that they're dependent on CCT. So to take them to a place of self-reliance, the next step is to conduct a financial assessment and set a financial goal with the family. So that a financial assessment will look at the family's existing income, what assets they have, whether they have any debt, and will take into consideration this support payment that they're getting from CCT to meet their basic needs. Out of that assessment will come the financial goal. So how much do the family need to cover all their existing costs and add to savings? So once the financial goal has been established, the next step is family finance training. So the first step of family finance training is financial literacy coaching, and that involves helping the family to avoid the scarcity mindset that often traps families in cycles of poverty. It also takes them through a process of avoiding debt and identifying needs versus wants, and learning how to budget and manage their household finances. Once they've gone through that process, then they will create a vision for how they want to meet this financial goal. If they require any skills development or skills training, social worker will help them access vocational training or an apprenticeship. If they already have the skills they require, then it will depend on whether they want to access employment to meet their financial goal. If so, the social worker will help them find safe and secure employment. If so, then they'll skip these next few steps. If they decide, and many do, most often we find that families prefer to set up their own micro business, they'll then be coached through a process of learning how to write a business plan. That business plan will then be submitted to CCT, and the business plan will be reviewed. And once the business plan has been approved, the capital will be transferred to the family to launch their business. Once the business is up and running, the social worker will work with the family to monitor and evaluate that business to see if it's meeting all the goals set out in the business plan. And if it's meeting all the goals, but it's not yet meeting this financial goal, what then happens is the family will have an opportunity to develop that business, and that might be through growing their existing business or setting up a second micro business. They'll then write a business development plan, and that business development plan will be reviewed, additional capital will be transferred, and then this step can be repeated as many times as required for the family to meet their financial goal. As the family's income is growing, the support payment provided from CCT will be adjusted accordingly. Then finally, once they've met their financial goals, so they're meeting all their basic needs, they have enough income to meet their basic needs, the social worker will help them set up a savings plan. And that, I might do another video on savings program, because we have a really interesting community savings initiative that runs alongside this. But once the family have their own savings program, at that point, whether they in the future, if they meet any obstacles or setbacks, they will have a buffer there so that they can overcome those obstacles themselves. Or if they want to grow their business, they can borrow from themselves. So once they've reached this process where they, at this point where they have achieved the financial goal and they're adding to the savings every month, we'll then redo the basic needs assessment to ensure that they are in fact meeting all of their basic needs. And at that point, the family really has reached a level of resiliency and self-reliance that they no longer need our support anymore, and empowerment is achieved. So that is how our Village Hive model works. If you have any questions, feel free to shoot them through.